Hi, this is John, trichologist at Freedom Clinic Toronto. Today I wanted to do a little talk on alopecia and the different types of alopecia, and also just talk a little bit about that specific term alopecia, as it is often misused in the industry. One of the issues with the term alopecia simply means hair loss. So there are actually many professionals and people, members of the public, who will refer to specific types of hair loss as alopecia. So it is important to remember that alopecia simply means hair loss and does not point to a specific type of hair loss. So let's dive into this and see exactly what we're talking about here. So what most people refer to as alopecia is a type of alopecia actually called Alopecia Areata. So in this case, the term alopecia is combined with another term that means areas. So in the case of Alopecia Areata, as you can see in the picture here, we have hair loss that looks like little patches or areas of hair loss on the scalp. So this type of hair loss, like I said, Alopecia Areata, it's very unpredictable. It can come in little patches like this in various spots on the scalp. It can affect males and females, children and adults, and it can migrate throughout the scalp. It can expand, it can contract, and it can sporadically regrow at any time. There are a lot of treatments for this, or a few treatments for this, so do speak to a professional about it if you are experiencing this type of hair loss. So that's Alopecia Areata. So now if we here's the same type of hair loss shown in the beard. So it can affect men's beards as well. Now, this type of alopecia is an autoimmune type of alopecia, and there's a related type of alopecia called Alopecia Totalis. So this is basically the same condition. However, we call it Alopecia Totalis when it affects the total scalp. So the total of area of the scalp, and in this case, the eyebrows as well, and facial hair is all affected. So we call that Alopecia Totalis. Related again is something called Alopecia Universalis, which again is the same type of hair loss, but affects the entire body. So a second type of alopecia that does not actually contain the term alopecia in its name is something called Telogen Effluvium. And I just want to bring this one up because this is quite common in the last couple of years, because Telogen Effluvium is a type of diffuse hair loss, so hair loss that occurs throughout the scalp. It's usually quite evenly spread throughout the scalp. And what happens is the hair will suddenly go into the resting phase, the telogen phase of hair growth, and start falling out. And this can happen quite rapidly, and it can be quite extensive. So when you see clumps of hair in your brush like this, or coming out of in the shower, then that's usually a sign of Telogen Effluvium. So a type of hair loss that doesn't have alopecia in its name, nevertheless it is a type of hair loss. This is a hair loss that is brought on by stressors, physical stressors, mental stressors. It could be vitamin deficiencies, hormonal imbalances, and one of the causes we've seen recently with this one is COVID-19. So developments of high fevers can often lead to excessive shedding of hair, and in this case, that type of hair loss is called Telogen Effluvium. The one good thing about this type of hair loss is that once the stressor is reconciled or abated, once the fever is gone, then a few months after that, this hair will grow back on its own, often without any treatment at all. So if you get hair loss from COVID-19, it's called Telogen Effluvium, and usually it'll restore itself almost probably 100%. It may take 3 to 6 months or even a year for that to happen, but generally it will happen on its own. So to continue, the term alopecia is often combined with other terms to describe this specific type of hair loss. So where we saw Alopecia Areata to describe little patches or areas of hair loss, in male pattern baldness, the term alopecia is combined with a word for androgens, male hormones, and genetics, where the hair loss is inherited. So then we have the term androgenetic alopecia. So androgenetic alopecia, also known as AGA, is the medical term for pattern hair loss, and this can be in both males and females. So looking at a male, you can see the general pattern usually affects the crown and of course extends throughout the front. You'll get recessions in the temples. This is a mid-progression, probably around what we would call a Norwood level 3, and this can obviously progress to a more advanced stage. So we'll just jump to the next picture of this. So here's a chart of the Norwood scale. This shows different stages of male pattern baldness or androgenetic alopecia. As we said, our patient we just saw before that was around a level 3 or 3 vertex, which means the crown is also affected. Okay, so moving on, looking at females now with androgenetic alopecia. You'll see now this is a very advanced case where the entire top of the scalp has thinned out quite significantly. This is a common type of hair loss for women, and again, the term is the same as it is in males, androgenetic alopecia. This type of hair loss in women can extend down the sides. And you see it's a general thinning. It's not like where the crown goes bald, but in women it'll generally affect the top, and it can spread down the sides and the back of the scalp. Here is a chart showing female pattern hair loss or androgenetic alopecia in women. It's called the Ludwig scale. We often use this to describe the stage of the hair loss that the person might be in, and that one we looked at would be an advanced case. So in this case of scarring alopecia, we have something called central centrifugal cicatricial alopecia. So that's a big word. Basically what it means is it starts from the center of the scalp and moves outward. Centrifugal means moves outward, and it's a scarring alopecia. Okay, so we have hair loss caused by scarring. This affects a lot of black women, some men, but mostly women, and it can spread throughout the scalp. Again, because it's a scarring alopecia, it is unlikely that any of this hair would ever grow back. So when we treat this, we want to try and stop the progression of the hair loss as soon as possible. So we notice that we have, again, descriptive words connected to the word alopecia. So the type of hair loss is very specific with this long name. So moving along, here's another type of scarring alopecia. This type of alopecia is called frontal fibrosing alopecia. So in this case, the alopecia, the hair loss, affects mainly the temple areas, the forehead, and it can also affect the eyebrows, as you can see here. And basically this type of hair loss will progress back a little bit, maybe a few centimeters, and then usually it'll stop. It won't progress past this area, hence the reason it's called frontal fibrosing alopecia. It again is a scarring type of alopecia, so unfortunately in this case the hair will not grow back, and we want to treat this as early as possible in order to stop it from progressing any further. There are a lot of different types of scarring alopecias. We'll look at one more. This is quite a common one called Lichen Planopilaris. Now we notice that in this case the type of hair loss does not contain the word alopecia. In this case it's simply called Lichen Planopilaris, and again it's a type of scarring alopecia that starts in the center of the scalp. It can be very scattered like this, and this can also progress throughout the scalp. So again, we want to treat this as early as possible to stop that from happening if we can. So we've talked about quite a few different types of alopecia here, different types of hair loss, and again, just to emphasize that the idea here is to understand that the term alopecia means hair loss, and we put terms, that descriptive terms combined with the term alopecia in order to to clarify exactly what type of alopecia it is. So if someone says to you, I have alopecia, then that doesn't really tell you too much. Try and get a more specific term, androgenetic alopecia, alopecia areata, frontal fibrosing alopecia, etc. So that's our lesson for today. Thank you and have a great day.